Welcome to the podcast series on the transformative impact of AI in healthcare. We are thrilled to have a special guest with us, Dr. Priyanka Bajaj. She is a passionate health technology enthusiast at Path with a strong track record of integrating innovative solutions into healthcare programs. With a keen focus on bridging the gap between the groundbreaking technologies and practical healthcare applications, she is dedicated to advancing the field and improving the patient's outcome. Welcome, Dr. Priyanka Bajaj.
Thank you very much. It's my pleasure to be on the podcast today.
So diving right into the questions, can you start by giving us an overview of how AI is being integrated into the healthcare industry and what key benefits are emerging from this integration?
Quite an interesting question. I can start by saying it's also an all-encompassing kind of question because when I look forward to the discussion today, the pointers that I might say now will also find reference to subsequent discussion that we have. So in terms of AI finding its integration into the public health system, let's start by looking at the public health system overall. And then see where AI is fitting into the problem statement. We start with, say, the larger health systems, maybe at the hospital level. So there are gaps in the continuum of care when we look at the health system. There are system level interventions that can fill those gaps, but then there are also technology level interventions that can fill again the unmet needs which still remains after system level interventions. And that's where innovative technologies come in. That's where artificial intelligence layering on top of those innovative technologies come in. Now, in a hospital system, suppose you have an electronic health records, you have so much of data and so much of information can come out of that data in terms of identifying the high-risk population, in terms of a patient follow-up, in terms of prediction of possibly an outbreak that might happen, and we have all the data, but we were never looking at it. So how do we facilitate this? And AI helps there. You come a step down to this, go to the periphery, go to the primary healthcare. The purpose of primary healthcare and as a pillar of what we say achieving the universal health coverage is to at least provide essential medicines and essential diagnostic services to the population. And when I say diagnostics, I think I should also include that we should not necessarily focus on a curative approach to just test somebody who's coming with a symptom, but also in a preventive way, look at an eligible population and screen that population for, say, a disease which we are assuming, or we not necessarily assuming, but we, based on suggestive evidence, think that this might be relevant for that group. Suppose 35 plus women age group, you might want to screen them for cervical cancer or breast cancer. And then specialist access is not there at that setting. So technology which has an AI capability to it, which can at least give a first level of screening, which can help with a clinical decision support, which can help with referral, can really improve the health indicators by allowing early intervention, by allowing more specific treatment options, and of course, saving lives as an outcome. You go a step down to that, and then comes us individuals. That's where also AI, you see whether it is looking at the health data of a person to see if that person is at a high risk of developing the disease or might actually be suffering from that disease. So you can have a more targeted intervention to prevent or manage that condition. You could look at possibly genomic data of an individual which might be suffering from cancer, which might be suffering from metabolic disease. And such large data requires automation. It requires algorithm. It requires a layer of artificial intelligence, which can look at precision medicine, a more targeted approach of treatment for that person. So I think at all of these levels, artificial intelligence has a role to play. And it has a role to play in the action that comes next to this. So whether it is in terms of disease surveillance, whether it is in terms of epidemiological data, in terms of a public health response to an outbreak, so that it doesn't become a pandemic, it has a huge potential. It has a varied potential, and I think I'm really looking forward to discussing more on that.
So as you mentioned, like AI can be, implemented at various levels of the public health as well as healthcare setting. So which area you think the most is needs this AI technology? Which area basically needs, or which domain or in the healthcare sector basically needs this AI?
I think prioritization also depends on the health system needs. Um, if you look at from a very generic perspective, where there is lack of specialist access, where there is lack of an infrastructure for very sophisticated instrument, is where very simple point of care tools which are AI integrated can find the most potential in covering large population, in at least screening, in at least identifying those who are at risk or those who are presumptively could be infected or could have a certain non-communicable chronic condition, and then refer them to the care. So wherever a large population needs to be covered for early intervention, for better access to health, is where AI can be really, really useful.
So next, I would like to ask that how this AI help to reduce the health inequities, and what steps needs to be taken to ensure that AI-driven healthcare solutions are accessible to all the populations, not only the urban sector but also the rural population.
I think that's the idea. That's the idea of bringing in artificial intelligence to healthcare. We do want process efficiency, but on top of that, we want access for all. And like I said, it can provide that access at all levels of healthcare, right from the high-end hospitals to a primary care to a community care setting also. The most important question is how, and that's what you also had in your question to me. Um, the how part of it lies in the life cycle of a product. So a product, when you look at a life cycle, typically, three words, if I can use, is design, validate, and deploy. The equity consideration comes into all of these three. So when you're designing something for the health system, which you want all people to at least have access to, in this case, a technology which has AI, the design itself needs to integrate the component of equity. Now, how can this be? One is you take data sets which are not biased. A lot of times in the early days of the development of such algorithms, we saw that, because they were coming from higher income countries, they were certainly having a bias for that population. We are fortunate to live in this, probably not, but to live in a tier one city, and that also is a certain kind of bias. But when you're designing those data sets, it need to take into sets from minorities, from different socioeconomic strata, from different demographics. So in the application, when it comes later, these populations are served with a robust data which has been tried and tested and developed with that kind of input. So that is one. Now, this also brings the value in validation. So when that evidence is generated and when you actually take this to a field, the performance will reflect how the AI is being developed. So that again brings in the component of equity, but then there are other allied things, not just the clinical performance. So in the development and when it comes to validation, you also need to see their end user, their level of digital literacy, their comfort with the language that is going to be used in that tool, so that it's an inclusive innovation and not just for the elite. Then you come to deployment. In the deployment, now there are different components, and we call this assessment of a feasibility of a solution. What comes to that is you look at the end user, which is your healthcare provider. This could be a specialist, a clinician, a frontline worker, an ASHA, or an ENM. How do they feel about using the solution, how comfortable they are, and how it fits into their workflow, how they are carrying it to the site where they're supposed to use it, if it is a facility-based solution, the kind of other infrastructure that is taking into consideration. That becomes the usability part of it. Then you have your patient population or the people on whom you're going to test this. For them, it's a technology that is probably their first phase of touch point. It may not be a doctor that they are used to. So how acceptable it is to them. So usability, acceptability, and then comes how it fits into an existing public health program, or if there are any changes needed to that. So for bringing in equity, this kind of a feasibility test needs to be done so that the solution can enter into not just the first creamy layer of settings where you would want to test just a few, but also say a community level, a primary care level, maybe hard to reach populations also.
So, as we know that AI has led to a lot of development at the time of this COVID-19 pandemic. So, how can these technologies be applied to the future public health emergencies as well?
Very interesting question. It's an interesting question because I'll start by giving all the examples of the, where AI was used during COVID-19, and you'll see how these things very well can be applied to any of the future public health emergencies, whether it is an infectious disease or whether it is a chronic condition or whether it is, I would say, the silent pandemic of antimicrobial resistance that we are all seeing, acknowledging, but let's see how that goes. So during COVID, we use this word very commonly. It's an unprecedented scale of calamity that we are seeing. It manifested on a large scale to the health, to the livelihood of the people, to the economies of the country. The possibly good thing that came out of COVID was that it brought health to the forefront. And it brought some very, very I would say, transformative technologies to the mainstream. The lab to market transition was very rapid, and we could see, and now we have that precedence of technology integration into the health system. And when there is a will, there is a way. Um, when there was, I remember early days of the pandemic and the lockdown was happening, we were doing tracing of a person's travel history. And there were a few countries that had deployed AI-based solutions to track travel history, to deploy that for facial recognition, even if somebody is not giving the right information, but there was a way to back check that. In India also, we saw that there were certain thermal screening solutions. One was the NIR thermometer, but also some facility, or I would say deployed at the airports or railway stations that had thermal imaging and that were using artificial intelligence to identify individuals who might be having a higher temperature, so could be suspected with the COVID infection. So that's how it started. It went on to certain marvelous screening tools. Some of the examples I have also personally worked with, and there were things like AI algorithms for looking at chest X-rays to see if this was the COVID-19 pneumonia. So there's typical ground glass opacity that came, and that clinical decision support could be provided to the doctor for rapid action. I've seen that has also evolved into now binary decisions. So whether the pneumonia is COVID or non-COVID. So that kind of differentiation is coming in. The software keeps evolving, algorithm keeps evolving. There came tools which were using cuff sound, and that was smartphone, just a smartphone using cuff sound, and then a layer of artificial intelligence that was analyzing it for COVID, for TB, for COPD. We also possibly saw in the step-down ICUs some vital monitoring solutions, and then these using some decision support algorithms again to find out if that person could be managed there or they required shifting to a higher hospital. In remote patient monitoring, because people were also asked to do home quarantine when hospitals were overloaded, and then there was always a risk of catching another infection in the hospital. So if the case is manageable, they were advised to do home quarantine. And remote patient monitoring, wearable devices which had a layer of AI were enabling teleconsultations also. They came to great use. There were algorithms that were being used to see if the person required oxygen or they required a more invasive intubation or ventilation, or they were like good for by a CPAP or other manageable device. So that's a screening, diagnosis, management part of it. And then of course the vaccines, that large libraries of mRNAs, and there is something called as natural language processing models that AI uses, and those were very critical in discovery of the vaccines. And we see this as the new platform which is being explored not just for COVID but for many other infectious diseases. In a very different sense, we also saw that, I remember there was example from an airport where robots were doing the sanitization of common public areas, and they also had a layer of AI to work with some level of you know, not that dependent on a human interface. And so were drones that were coming up for supplying essential medical commodities to the last mile and hard to reach areas, and areas which have issues with seasonal variations. Or we also did a pilot in Arunachal Pradesh for a drone technology, but that was for a different purpose. Yeah, AI is again there when you want to reduce the human intervention, but you also want to evolve the technology for more precision and more access. If I'm not going that long, I think I might want to touch on your aspect of how this can be applied to other public health emergencies. All of this can. The component where I said vaccine development was guided through the NLP models is something that is currently being used for other infectious diseases, but there are also algorithms which are being used to identify new docking sites for antibiotics or new targets for navigating through the antimicrobial resistance, for discovery of newer antimicrobial molecules which can possibly be the future of therapy for bacterial infections, fungal infections. And one more component, lastly, for NCDs, we tend to often ignore them. We had suffered the burnt of ignoring them during COVID-19 because they didn't go anywhere, and now they are just looking at us all the more aggressively, if I may say so. But yeah, I mean, you could also look at screening and everything with the chronic condition, but also some screening of the large molecule libraries as the therapeutic options, which otherwise would have taken long time. AI just fastens everything. It just is a matter of scientific accuracy and demonstration of evidence.
Thank you for such an in-depth information that you have just shared with our listeners. So moving on to the next question, what steps should be taken to build a sustainable AI-driven healthcare system? And what role can policymakers, technologists, and healthcare professionals can play in this process?
No, I also look forward to the answer of this question because that solves the puzzle. And if I find more experts speaking on this, I would be very happy to listen to them and note down into my set of observations. So far, what I have understood with my experience and what I have learned is that we are talking about building something, so building is always built on a foundation. What is the foundation for that sustainability in AI? I think it's one, the people for which it is being developed. So taking a human-centered approach, looking at your end user, looking at your population, looking at the clinicians who are going to use it, and also still keep a control of humans over AI is a foundation that needs to be really strong. And so does the foundation of the ethics that comes with it. There are a lot of discussion around this, and sometimes they go on a different tangent also, but in a very I would say logical way. If technology is coming and we are thinking of it as, if not replacing humans, but at least adding a layer of technology that reduces the burden of humans. So it is going to take care of certain amount of work that humans were doing. So it needs to do that ethically. It has to have that, because again, from the people's perspective, it is technology doing some part of work that they have been used to seeing a doctor do, or the person they used to trust used to do that. So transparency, accountability, privacy. There needs to be proactive efforts to provide that information so that the sustainability is also in terms of the end user adoption. Now, this also brings in the factor of multi-sectoral collaboration because a developer individually cannot do this, the healthcare provider cannot individually do this, the systems also cannot do it all by themselves. So they need to work in sync. They need to also look at the evidence, but also look at the standards. So certain gold standards like HIPAA, so cloud storage, safety audits, timely audits. All of this have to be part of giving, say, a license to a product. Now, AI also, you see software as a medical device, so they come under medical device regulation. But how to implement them in a more holistic approach? Of course, you can give a license, you can give a clinical license, but in terms of sustainability, to bring that trust architecture around the technology is important in its sustainability. And of course, the process never stops, so it is iterative, it evolves. So, in terms of ensuring sustainability, also it should, with time, with more data coming in, should not be static. It should keep evolving for a better clinical performance and for better health outcome because that's what we are all aiming at.
So, as we all know that this AI is leading a lot of innovations, not only specifically in a healthcare setting, which includes the maternal health, the mental health as well. So, what are some of the most exciting AI innovations on the horizon of the public health specifically, and how might they transform this field in the next decade?
And because you mentioned mental health, that also reminded me, just going back to the previous question when we were talking about COVID, and we also saw a lot of concerns around mental health because people were restricted to their homes, and not all of them have that kind of emotional support. And you see, AI also was playing an important role. There were different chatbots and applications where people could put in their queries. They could also seek sort of a therapy, which for which they could not step out of their homes, but nevertheless, healthcare could come in. That, having said that, I think I can answer your question with some of the first-hand examples that I have had the experience of working with. So, possibly dividing this into certain areas where AI is playing a very important role in the present context. So certain things are, they used to be very, very important, certain things in the present context, and then we'll also look at futuristic things which show promise. I think in the cancer screening space, there are some amazing technologies that are coming in. At Path, where I work at, and we have a district model approach in Satara district in Maharashtra, and we are strengthening the primary healthcare centers there, and we call them smart PHCs. So these are strengthened with different devices and diagnostics that should provide the expanded package of healthcare delivery for the health and wellness centers, which now we call the Ayush Man Arogya Mandirs, and then the sub centers. So solutions like, we have a solution which is a thermal imaging, and on top of that, artificial intelligence can screen for breast cancer. It is minimally invasive, it assures privacy, and it's not that difficult. So a healthcare worker at a primary care setting can easily do that. We also have a cervical cancer screening solution, which is a imaging tool, and then it has a cloud data storage capacity. An OBGYN sitting remotely can also see that data, but also AI layer can do the first level of clinical decision support. There are solutions in the cardiovascular disease management. For example, a smart stethoscope, which it's very interesting. It converts sound to image, and then image is read by the AI/ML algorithm, and then it can tell any abnormalities with cardiorespiratory, and it's been shown to have impact screen for individuals in mid 30s 40s which would have otherwise been missed for heart murmurs or conditions like this at the primary care level. Solutions like I was talking about chest x-rays being read by AI. So there is one such solutions that we are also implementing, and It can read the chest X-ray for TB, or it was also being implemented during the time of COVID. These are some solutions, but I think again with all of us having access to smartphones, there are a lot of new health technologies or digital technologies coming in which are smartphone enabled. So the smartphone camera through photoplethysmography or techniques like this is able to look at hypertension just by the selfie camera. It has algorithms to screen for it. Of course, it doesn't tell you that this is a confirmatory diagnosis and go for a medicine until that stage comes. But it is certainly a level of intervention which nudges you to seek care. So hypertension, arrhythmias, uh, an indication for a possible stroke. So that I think is something that's going to be the future of digital health and AI-enabled technologies. Because it's with everyone. I mean, even in the tier two cities, we see smartphone accessibility is now not an issue. Internet accessibility is not an issue.
Thank you so much for sharing such an amazing examples. Lastly, I would request you to kindly share a short message with our listeners that you want to give.
To the listeners, firstly, thank you so much for listening to my long answers. I hope these were useful. And secondly, I think the crux of the message is to break the silos. It's important that the young innovators work with the clinicians, work with these health systems, work with the patients, work with the populations, work with the community providers, and create a solution which is not a retrofit. It actually meets the need of the health system. It is affordable, it is safe, it is quality assured. It comes into all of the guiding principles that we have for any health technology. And do keep you know being better. Don't just stop at deployment. It's not the end of the game. Be a solution provider, and that's a borrowed line from my boss. That be a solution provider, not just a technology provider.
Okay, so thank you so much. And that brings us to the end of today's episode. Dr. Priyanka Bajaj, thank you so much for joining us today and sharing your invaluable insights on the transformative role of AI in healthcare. And thank you so much for such an insightful discussion. Thank you so much for joining today's session.